We talk a lot about food deserts, places where it's very difficult to get fresh, healthy food, people eating much more processed food and at the same time gaining weight. Well, now there is a new program out there. It's food vouchers, fruit and veggie vouchers to fight childhood obesity. We're going to take a look at the program, see how it's working. 48 minutes past the hour. 50 minutes past the hour. Welcome back to the most news in the morning. In this morning's Fit Nation, a coupon a day to help keep the doctor away, essentially. In Boston, there's a pilot program underway right now that encourages families to shop at local farmers markets for fruits and vegetables. And to that end, they're giving coupons amounting to $1 a day for each family member. And the goal is to shed pounds, one apple or eggplant at a time. Joining us from Boston to talk more about the program is Dr. Shikha Anand, Medical Director of the Healthy Weight Initiative at the Ceiling and Visibility Unlimited organization. Thanks so much for being with us this morning, Doctor.
Good morning, Karen. Thank you for having me.
So it's $1 a day per family member. Explain how the program works.
Sure. So we run a series of obesity clinics in 8 health centers throughout the state of Massachusetts. For this season, we've piloted in 3 of our health centers, those at Codman Square in Dorchester, Greater Lawrence Family Health Center in Lawrence, and Holyoke Health Center in Holyoke. We've given out these coupons. And so what happens is when patients come into these obesity clinic visits, we assess their fruit and vegetable intake routinely. So as we ask them what their intake is, there's often room for improvement, as you can imagine. So for families who have a lower fruit and vegetable intake, we provide these coupons, and what we do is we calculate, as you said, $1 per day, $1 per serving, and so the goal is to increase by 1 serving per day per family member. So for a family of 4, this amounts to $112 per month, and these coupons are in $2.50 increments, and they can be taken to local farmers markets to be redeemed for fresh produce.
So what's been the response right now? Any anecdotal changes from family members who have been part of the program? Have they been able to incorporate more healthy foods and perhaps lose weight?
Yes, so we've definitely heard anecdotal evidence that families are really increasing their consumption, and they have an increased awareness of the farmers markets in their community, as well as have tried new vegetables and new fruits, and particularly you hear that from the younger children. In addition to that, we have had some anecdotal evidence that family members are losing weight. We track the weight on the index children, the child coming to the obesity clinic, but we've also heard that other family members are losing weight as well.
And so the point of the coupons is so that the money or the voucher has to go toward certain healthier eating. I mean, rather than if you just gave people, let's say, $100 a month extra for groceries, because we know that times are tough for many people right now, just in terms of putting food on the table, that they would not necessarily choose the healthier foods while they're starting with the program.
Well, yes, there are 2 barriers to families choosing these foods. The first is access. As you mentioned, there are food deserts, and so in a lot of these underserved areas, there isn't really a lot of fresh produce available within the local grocery stores. The second is that often processed foods are cheaper in America than produce is, so families who are really struggling to put food on the table may not be able to afford produce for their families. And that's the reason why we've chosen to budget for every single family member, to allow for enough for each family member to really access the food.
You know, this is a wonderful time of year in most parts of the country to get fresh produce. You know, the local corn in many areas, tomatoes, all of that, very prodigious in the summer. What happens, though, once these farmers markets, you know, start to close down as we get into the winter season? How do you continue this program and thus the healthy eating initiative for these families?
So we do partner with a few year-round farmers markets, and the foundation that we work with, Wholesome is really dedicated to providing fresh produce access to low-income families year-round, and so we'll work to expand those year-round farmers markets. In addition, we're looking to partner with grocery stores or other vendors of vegetables that we could get to our families year-round.
Well, it's a great initiative, and we certainly hope that it works. And congrats to you guys for trying something new and different and innovative in terms of trying to get people to eat healthier. We appreciate it. Dr. Shikha Anand, thanks so much.
Thank you.